Pilonidal cyst is one of those conditions that we see it in mostly young patients, and it's quite annoying. It's typical for us to see a patient who had 3 to 4 surgeries before they come to us. The reason why they recur, again, is not understanding the reason behind the formation of the pilonidal cyst. It's the same thing with the fistula and the hemorrhoid pain and so forth. Basically, you go back to the medical school where most of the doctors actually were trained that these are congenital defects and you have to go in order to remove them permanently all the way to the presacral fascia. This is the deep layer, and try to remove as much tissue as possible. That was all wrong. These are mostly superficial subcutaneous defects that they form because the overgrowth of bacteria in the only area in the body that's anaerobic. Basically, there's no air entering this region. And this we started to understand it as we did a tremendous number of these cases where we found most of these sinuses are really superficial, no more than 1 to 2 centimeters below the skin. And they expand upward or downward. Sometimes they go on the sides. So there was really a need to develop a newer technique that will not be as invasive as the older technique, but take care of the problem at the same time. We basically now at our group level, we have 2 categories of procedures that we treat all pilonidal cysts. Those early ones can be treated simply with the ENDO laser technique, and we have a special method that we use that gives excellent results. And there is that second category of those patients who have deep sulcus or deep cleft, natal cleft, or they have multiple recurrences. These, they need a very simple plastic surgery type of procedure that we do with a limited incision, no stitches on the outside, that we will correct the defect that they have. Because as long as they have this defect and this anaerobic environment continue in that sulcus, they will keep having recurrence. So this could be done again under local anesthesia with simple sedation. Again, the same reason and mentality that we use in all proctology. You treat the real reason, the patient will be cured.